I just need, all right, we are all set.
All right. Thank you, folks. Appreciate your patience. Let's dive in. It is Friday, December 18th, and we have a number of important updates to give with respect to what is happening with COVID right now here in Burlington and in Chittenden County. Well, let's start the way we often do with quickly looking at the dashboard, looking at the numbers. You can see that cases in Chittenden County continue to modestly climb. It's quite a significant climb since the beginning of November. There's been some dips, but we do continue to see growth. You can see there the latest does 70 cases yesterday, one of the largest that we've seen. This increase is, while still relative to many other parts of the country and on many metrics, while we continue to do considerably better than just about anywhere else, this is not where we want to see new infections. And this level of new infections, we're not comfortable with it. Talked to Dr. Levine yesterday. That's his characterization as well. And what this level of new infections means is that the virus is now getting into these areas that we have really been working very hard all to protect: the long-term care facilities and our schools, our businesses. You can't have this level of community transmission taking place and completely succeed at keeping the virus out of these facilities. The main reason for that, we believe, is that the virus can be carried, is often transmitted by people who are not symptomatic or not symptomatic yet. And that is the story consistently in how the virus gets into long-term care facilities. People should look at those numbers and know that they are significantly impacted by the large numbers of positives we're seeing at Elderwood, for example, but it's certainly not just there. There is community transmission, additional outbreaks and situations occurring as well. I think Dr. Levine said yesterday there were, correct me if we're joined by Burlington's COVID leader, Brian Lowe here. I think Dr. Levine said there were 15 different outbreaks in Chittenden County, within Chittenden County over the last 2 weeks, and about 6 of those are in long-term care facilities. So there's significant transmission happening outside of that. We're continuing to be in contact very regularly with the long-term care facilities, doing everything we can to make sure that they are aware of the resources available to them, aware of the latest updates with respect to the virus. We have heard several reports that these long-term care facilities have gone on their kind of highest level of alert and gotten staff tested early in response to, as these positives started to rise, and that has been successful in at least a couple cases in isolating individuals who are positive before there's a broader spread. The most positive thing we are hearing that is about to happen in the skilled nursing facilities, which is a subset of those long-term care facilities, the facilities that are most at risk, starting on Monday, those residents at those facilities will start to get tested. And Dr. Levine confirmed for me again yesterday that within 3 weeks of Monday, the 21st, every resident in a skilled nursing facility should have gotten at least their first dose. Hopefully, the plan is by that time that many of the healthcare workers in those facilities, if not all of them, will also get their first vaccination just in the coming weeks. So I think with that, this is a new way for us to represent the wastewater testing that we're receiving. Brian, you want to say a couple quick notes about this graph, and then I'd like to get in Superintendent Flanagan, who has some updates on what's going on in the school district.
Okay, will do, Mayor, and I'll be quick. Just on this graph on the right-hand side of the slide, it shows you color-coded the readings that we're taking from each of the 3 different city plants. It's a logarithmic scale. And so, for example, the growth that you see in the blue line in the north end, that's significant growth. And so that kind of scale, that linear growth on a logarithmic scale indicates significant growth in the city. And so it's been somewhat volatile, but we are definitely seeing overall trends that are higher than they were prior to Thanksgiving.
All right, I think it's an important note because sometimes we've shown that data, I think, on not on a logarithmic scale, and some of the increases look even more dramatic then, right? So, but this does show what we've been reporting, steady increases pretty much citywide across the 3 plants, further confirming, where we started and what we know at this point, that we are in a period of elevated virus prevalence. As I said before, because of that elevated prevalence, we are, after months of real success of not seeing any positives in the school district here in Burlington, that has really changed over the last week. It's happened. We've experienced it here in my own household. We got a call yesterday, Superintendent Flanagan from the school saying that one of my daughter's classrooms had been impacted. This is happening to a number of folks. Why don't you bring us up to speed on how you see the challenge right now?
Sure. Thank you. Thank you, Mayor. Appreciate you bringing me on today, too. First, I just want to say that our schools remain very safe places. We have many safety protocols in place that are ensuring that there is not transmission of COVID-19 in schools. However, we do have individuals who have been positive for COVID-19 in our schools. And so we've decided to move to remote learning on Monday and Tuesday of next week. Winter break starts on Wednesday. And so this gives our community time to regroup and to recharge. The system is under stress, really due to contact tracing. So the work that we are doing alongside the Department of Health to notify families about possible potential contacts is really a heavy lift, and then also staffing because of the kind of the quarantining that needs to happen as we ensure that everyone continues to stay safe. Has put pressure on the system, and I think I believe it's important for us to take Monday and Tuesday to regroup and recharge. I will say that teachers, staff, our school leaders have done really an amazing job of keeping on top of this, keeping schools safe, making sure that communication is happening with individual families who need that individual contact. And so I'm really pleased with the way that our school leaders, our teachers, our school nurses have done amazing work to make sure that we're communicating, we're staying abreast of all the public health information, and really keeping the community safe and acting quickly when we need to. The Vermont Department of Health continues to reinforce with me that our schools are safe too, and that's really because there's no cases of transmission within the schools at this point. And up until last Thursday, December 10th, we had no cases in the schools at all. And at that point, there were 171 cases in schools across the state. So we really have done a remarkable job as a city and as a district leading up to December 10th. Since December 10th, we have had 20 cases in our schools. And so we've been working really hard to make sure that we're communicating updated information on those cases and making decisions that keep those communities safe. There are cases across 8 locations. So I'm not saying schools necessarily because we have some schools that are in multiple locations, but in 8 locations. We still have not had any cases at Champlain Elementary School, at Smith Elementary School, at Hunt Middle School, at 9 of our Burlington Tech Center locations, any of our property services, food services, or administrative offices. But we have had cases in 8 locations, and that's why I made the decision earlier today, after consulting with our board chair and talking to you, Mayor, and also to our Secretary of Education, Secretary French, about this decision, and I ended up making the decision. It's not an easy decision. I believe our students need to be in schools. Our students tell me that they need to be in school. I met with a group of high school students the other day, and they told me how important it is for them to be in person. So I don't take the decision lightly, but I do think we need these 2 days to regroup and to recharge. In terms, messaging when there are cases goes really specifically to individual families that are directly impacted. And because of confidentiality, the messaging is pretty broad and not specific to the broader community, which leads to anxiety. So one of the things we're going to do is work on a webinar or some type of meeting in the next couple of days that details the process specifically for our staff, so they understand the process that's happening behind the scenes, and really help to allay fears, so that we can be ready to open on January 4th. We are still planning to come back and be in person on January 4th. While we're out, we are providing food. We know that we, as a district, we're committed to making sure that our families have food and supports over these holidays and with these extra 2 days as well. So we are providing food at 10 sites across the city, and information about that is on our website. There are food boxes that contain 3 meals a day, and we're distributing food at 10 sites one time a week once a week, 3 times over the break. Lastly, we're looking forward to coming back on January 4th. Really wishing everyone a restful break, a wonderful time with their families. I know it's hard to say that and hear that maybe at this time, but it's really important that we take time and enjoy time with our close family. And just a really strong reminder that we not travel, that we avoid gatherings with family and friends, that we stay home and wear a mask when we need to go out, and really take those safety precautions seriously, because they have helped us stay in school. And so I thank the community for that and encourage us to continue to doing that. And those are my updates, Mayor.
All right. Well, Superintendent Flanagan, thank you for all that. Thank you for your collaboration throughout this pandemic, and I do appreciate the way you've been in touch throughout, including around. As you mentioned before, making this decision today. I think that kind of collaboration between the schools and the city is particularly important at this time. I really appreciated the whole approach and your focus and priority on getting kids back into school, and also understand why you're making this decision for the first 2 days of next week. Certainly, we're all rooting for you that with the timing of the holiday here, hopefully this hiatus from in-person learning can be brief, and the children can be back in schools on the 4th, like you said. I want to just make sure your point is crystal clear, and just amplify it about how it can be the case that we're seeing 20 positives, as you mentioned, and be able to say with confidence that the schools are still safe. And I just think the key point there, at the risk of repetition, is that although there have been these 20 positives now found over the last 9 days or 8 days, none of them that we're aware of at this point they were all individuals related to the schools who contracted the virus outside of the school district. There's no evidence yet of transmission within the schools. That could change in the coming days. Of course, we have some kids who are quarantining now, and others who are quarantining as a result of being close contacts here. But at this point, your belief, as I understand it, Superintendent, is that these 20 positives, none of them contracted the virus in the schools.
Absolutely. Yes, Mayor, that's my belief. And it's also the Department of Health's guidance to me is that we don't have transmission in schools. And we have strong safety protocols in place from when students come into the building and throughout the day. And so we're going to review those before we come back on the 4th, so double down on those just to ensure that they're continuing and that we continue to be a safe place My three daughters are all in school today. I was in three of our schools today. I was in three of our schools yesterday. Schools are running, and students are in class and learning, and school is happening. So I feel safe in schools. I feel having my daughters in school. I feel safe for them. And so, yes, we can get back safely, and we have to take it seriously and take all the precautions we need to take outside of school to make sure that we're safe in school.
Great. All right. Are you able to stick around if there are questions from the media? Or are we gonna... Okay, great. Let's. There's several other topics. Then next up we have Chief Locke joining us. We're going to talk about vaccinations briefly. Certainly, it has been tremendously moving this week to see the vaccine start to be shipped out from the Pfizer laboratories around the country, and kind of fanning out by truck and airplane and arriving here in Burlington on Monday. And then the first Vermonters start to get vaccinated this week. It's just a tremendous victory for modern science that we have gotten to this moment so quickly, and a bright spot in a challenging year. And as so many others have said, it is a signal that we can see the end of this now. We know how this pandemic will end. There's still certainly a lot of hard work to do to get us there, and there's definitely some tough months between now and when that happens. But it is nonetheless incredibly hopeful to see the vaccinations begin. Invited Chief Locke on to share a little bit, because among these first vaccinations were Burlington's own firefighter EMTs, who have been on the front lines of this pandemic since March. They have been called upon, I don't think we know how many times, right, Chief, to transport individuals who turned out were carrying the virus, and they've done so bravely, without hesitation, and I think every indication is quite safely, right, Chief? I don't think we're aware of any transmission happening on an Burlington ambulance in this time, yet there's no doubt that at times that positive patients have been transported, and that these firefighters are at risk. So it is reassuring to me to know that they're valued in this vaccination plan, and that they're starting to get the vaccination. Thanks for coming on. How's the mood in the firehouses this week?
Good afternoon, Mr. Mayor. It's almost a sense of relief. It's very much an exciting time, and it was probably even like last Wednesday when we got to submit our rosters to the hospital, so that share the information to line up vaccinations. And when they told us it could be happening as early as today, I was certainly doubtful, but we actually had members start receiving their first shot yesterday, and more members are today. And so we expect within the next 3 weeks. They've asked us to break our staff into three groups. So basically, not so we don't have a whole shift getting the vaccination the same day. And then over the next 3 weeks, each of the members will have the opportunity to get their first shot, and then 3 weeks later get the second shot. So we are excited to be in the first group of, we are pre-healthcare, pre-hospital medical providers, and we're excited to be part of those first ones to get the vaccination.
Chief, and just do I have this right, that even the people getting vaccinated are not, and this is something that is often misunderstood about our system, right, is that it's not just the firefighters who are staffing the ambulances who have that EMT training and who have to provide that frontline medical care service. Really, any member of the team that is on duty at any one moment could find themselves rendering care to a Burlingtonian, and so everybody is getting vaccinated, but in these shifts, so that and that's interesting. Can you say a little bit more why they're recommending people break it up like that? I think this is a kind of an interesting detail for people to start to understand.
Sure. So you're correct. So all of our staff are offered it. All 83 of the staff are offered the vaccination. And the reason they want to break it into, basically over 3 different groups is that some people for 24 or 48 hours after they get the shot experience some mild symptoms of sickness. And so what they're trying to avoid is having the entire in our case, the entire department out on sick leave. And so they by phasing it in over 3 weeks, you may feel under the weather for a quick period of time, but then you'll be able to return right back to work. So we are, we're certainly moving in that direction. And because the other component of it, in just a few short weeks, we anticipate that our people will be able to administer the vaccine in pop-up sites throughout the city and throughout the county. We've been asked to participate in that and expect probably in January that will start. Very similar to random, testing of swabs. Now our people do that. They'll also be able to administer the vaccine.
Well, we're excited to start that discussion and start to see those operations get set up. It's a monumental task that we face in the months ahead to vaccinate something approaching 300 million Americans. Hopefully, I look forward to having you back, Chief, to talk about the role your team's going to play in the implementation of that.
Thanks for having me on. You have a great weekend.
Okay, you too. So we know that the vaccinations as a solution remain some months off in terms of everyone getting vaccinated. So in the meantime, we're going to continue to need to exercise vigilance and all the care, all the methods that we have learned to contain and slow down and avoid the transmission of the virus since March is going to need to continue. And one of those big strategies, of course, is when there is reason to believe you may have been exposed to the virus, to get tested. And as we've been talking about so far in this briefing, we have more Burlingtonians right now who need access to these testing services than at any prior point in this pandemic. There has been a big change in the testing infrastructure as the case numbers have been rising here in Chittenden County. There's also been a dramatic increase in the testing capacity here. So it's a very large number of tests taking place right now, basically every day in Chittenden County. The purpose of this is to keep this box it in strategy we've talked about so many times, the containment strategies of testing, tracing, quarantine, isolation, to keep that system going even at this elevated virus levels. I think we have some despite this additional capacity, we know that some people who want to get tested at this time are having challenges accessing the free public testing system. There are other routes to getting a test very quickly through some of these paid services, but our focus at the city has really been to ensure that we have as robust as possible a free public testing system. It can be more right now. Some of the systems for accessing the testing system, some of the websites can be challenging for individuals to navigate. So we want to make sure everyone is aware. If you're having trouble finding available testing through just the Department of Health website, we recommend that you call 211 to get help navigating through that. My understanding is that the person that you will talk to when you call 211 can actually even, and Brian, correct me if I don't have this quite right, but I believe they have the ability even to directly sign people up for some of these tests. Did I get that wrong?
I think they can work with you to get you signed up. I think some of it, some personal information is required. And so you still need to have the individual sign up, but 211 is quite helpful.
The feedback we've gotten is yes, exactly that. The 211 can for people who are having trouble navigating the system, that can be very helpful. In addition, if we can advance, Olivia, we have another new location responding to what's going on in Burlington that we want to announce right now and try to get the word out, because this is for tomorrow. There's another city pop-up back at the Miller Center again in the New North End. There are still many slots available for this pop-up, and which again, we know we've heard in the last couple of days some challenges with people getting signed up. So here's another way to do that. There is the pre-registration information. And so, Brian, just to clarify, you sign up for this pop-up in a different way than the other state testing. Is that right?
That's correct. Sometimes when there's very high demand in or around Burlington, VDH will look to the city to try and support providing additional testing options for residents. And so this is a pop-up set up by the city with the support of VDH at the Miller Center in the New North End, rather. The registration process is different. It's the city contracting with Garnet Health, which is a private company, but does testing in a separate contract with the state at our other 405 Pine facility, and also provides testing at the airport. So this is a link to the Garnet site. You register there, and there's a final slide on that. Garnet registration site is a little bit confusing, and some people think they have to pay for this service, but the city has covered the cost. There is no cost to registering here. And one last thing, Mayor, is just to emphasize that in addition to the 405 Pine and Winooski sites, there are interpretation services that will be available at the city site tomorrow as well.
Okay, just to make sure that's clear, the daily sites at 405 Pine Street and the O'Brien Community Center in Winooski, which can test hundreds of people every day, at least 250 a day in the Burlington site. And I'm not sure what the capacity is in Winooski, Brian. Is that another?
It's not quite as large as Burlington because their hours do vary day to day, but it's still a significant amount.
Okay, so at those two locations, every day there are translation services available. In addition, there will be translation services available at this Miller Center site.
That's correct. And there's one further site to emphasize. Sorry, Mayor. Just in the Old North End again today, there's an additional site that's been stood up. This site does accommodate walk-ins. This is the 294 North Winooski North End Studio site, and that can accommodate walk-ins. It's running today from 9 to 3, again with case managers or with interpreters on site to assist, who've been just really outstanding through the last couple months.
This is the second Friday in a row of that pop-up, right, Brian? And is that pattern going to continue, or what's the latest on that?
My understanding, the dates are not firmed up completely yet, but my understanding is that will restart again in January after this Friday.
Okay. All right. And again, let's, I'm not sure, I think we may have it on the next slide. We want to talk again about who should consider, I guess, sorry, it's up there on the second bullet here. The people that we are recommending, and that really, the governor and Dr. Levine, public health experts are recommending get tested, are people who have recently attended any kind of social gathering, traveled out of state, participated in another high risk activity. I think we should, add to this. We know certainly if you have been contacted because you have been in close contact, because you've been a close contact of your child has been a close contact of a student in the schools, that's another universe, another population that needs testing services now at the right time. And you should follow the guidance that you've gotten on when's the right time for you to get tested. But it can significantly shorten the amount of time someone needs to be in quarantine as a result of having been a close contact if they can access these testing services. So anything else to add on testing, Brian?
Just one final note that while these services have been available every day of the week for a couple of weeks now, they will be shut on the 24th and 25th of December and the 31st of December and the 1st of January, because the lab that processes all the test results will be closed on those days.
Great. That is an important point. Thanks for highlighting that, Brian. So let's move now to contact tracing, this other critical part of the virus suppression effort. Vermont, on many metrics, as we've talked about, continues to do very well, even with these elevated levels of virus prevalence. For example, we don't have Dr. Leffler on this week, but we have gotten reports from the hospital, and the number of people in the ICUs, the number of people in the hospital continues to be quite low, well within the capacity that the hospital has for treating people with the virus. An area where we are seeing real strain on the system is within the contact tracing. And you can see that this is something that comes from the COVID Act Now website that we've talked about many times before on this briefing. And you can see that the rise over the course of November really has taken, a lot of the capacity that we had when there was less prevalence is now being consumed, but keeping up with these new cases. We did just want to give an update. The city is now engaged in this effort to help the state maintain the capacity necessary to continue the contact tracing. 14 city employees have joined the state's contact tracing team and are going to be 3 days a week for the next 6 weeks, I think, including this week, part of that Department of Health team that is trying to keep up with each new infection and alert, figure out who is a close contact and help alert those folks. So I'm really thankful that we have had city team members that are willing to step up in this way. I'm thankful for the department heads that are managing their responsibilities and helping us redeploy some city staff to this critical public health strategy. Brian, what would you like to add to that?
Aaron, I think that's a good summary, and I won't add anything there.
Okay, sorry to take it all up there. So let's see. We really just wanted to finish with again, just sort of looking at the big picture. We've looked at this map before. It looked quite different over the course of the summer. Vermont for the summer and well into the fall was often green, while the rest of the country was yellow and orange and a little bit red. Now, you can see most of the country has gone red or even dark red. Vermont just one of a couple places around the whole country that, if you look, you can see, I think that's Hawaii and I'm not actually certain what the island shown off the east coast of Florida is there, Brian. I'm not sure if you can enlighten us. Is that Puerto Rico?
I think that's Puerto Rico.
Yeah. So it's Hawaii, Puerto Rico, and Vermont that are in what COVID Act Now is saying is slow levels of virus spread as opposed to outbreak or urgent outbreak. And that has led, that's what's allowing our hospitals to stay in good shape versus 1/3 of the country now is living in a place where they are essentially at ICU capacity. That continues to be, saw that continues to be the case over the last week. And we're doing better because Vermonters have been committed to this. And I guess we just wanted, as we head into the Christmas holiday here, as people finalize their plans for next week, we wanted to just reiterate that Vermont, and the governor said this earlier today, what we are recommending as the posture for, what our recommendation is for the holiday is that it continue to be what essentially the same guidance that we had during the Thanksgiving holiday, which is that really the only safe way to celebrate the holiday is to do it with the members of your own household and not to go beyond that. If that is our strong recommendation. At the same time, we are reinforcing the message that if somehow you do come into contact with people outside of your household, we recommend you get tested both before and after, and quarantine, follow the governor's recommendations on quarantine if you do travel. If you are thinking about being with some other member of your family or loved one that is older, has underlying health conditions, we particularly urge you to reconsider that and think about the risk in this moment. The safest way to celebrate, as we were saying there in the bullet there, is to celebrate with those that you live with. I think it would be, to me, just the moment we're in now, when we can see the end of this pandemic coming, when we can see the vaccine starting to be deployed, every every new infection and death that we have from this point on feels particularly tragic to me, given that safety and help is really now almost within reach. Let's all do everything we can to avoid more tragedies in the final months. We've done that so well as a community since March. Let's rally over this holiday and finish, head into these final tough months of the pandemic in as strong a position as we can. With that, I think we would take some questions, Olivia.
Great. First up is Courtney from 7 Days. Courtney, you should be able to enable your microphone now.
Can you hear me?
Hi, Courtney. Yes, we can.
Great. Mayor, I'm just wondering, I don't know if you've addressed this in the past, but how often have you been tested for the coronavirus? Are you on a regular schedule, or just kind of curious?
I'm not on a regular schedule. I think I've been tested twice so far, and I'm going to get tested again, hopefully in the coming days. I might go to that New North End pop-up tomorrow, and that, as I suggested to Superintendent Flanagan before, we've, the system is working. We got a call from the school district saying that my daughter was recommended to quarantine based on having come into close contact with someone who had tested positive. And so that's part of why I'm coming to you from home today. And I do anticipate getting tested for a third time in the coming days. I also at one point had what turned out to be kind of cold symptoms. I think it turned out to be a stomach bug, but I got tested then and stayed out of the office until I got the test results back. And that's what we recommend everyone else do. If there's some reason to be concerned, you might be carrying the virus, we urge caution, we urge safety, get a test before you expose others.
Great, thanks for sharing that. I did have somewhat of an unrelated question.
Sure.
And because your time is so short all the time, I just have to take advantage. Sorry. So I just wanted to switch gears a little bit to this independent control board, the police board that the council passed. You had expressed some reservations about it. I'm wondering if any of the amendments that were made to it at the council meeting address any of your concerns about it. When we spoke before about this proposal before, you had mentioned some concerns that about the chief of police's role in that process, and there was one amendment that sort of addressed that. I'm wondering if your views on it have shifted at all since the council discussion on Monday.
So Courtney, there were a number of changes that were shared. A couple by Councilor Freeman. About 2.5 hours before the meeting started on Monday, and that did end up getting changed in the version of the resolution of the charter change that was passed by a slim majority on Monday night by 7-5 vote. And as I said at the time, I'll reiterate now, I think a number of those changes were significant changes. I welcome that there was some response to the many concerns that are being raised by many people around the community about that charter change. Unfortunately, I don't think the changes went far enough. There was no direct communication with the administration in the days leading up to the vote on Monday, despite, as you know, my repeated offers for the administration to meet with the sponsors of the resolution, try to find some kind of common ground. The resolution that passed really was not, it was, I would say, a little bit responsive to the concern about the chief, but nonetheless, I think the language that is in the charter change right now would make it very challenging for us to recruit a top tier skilled chief, that the chief would essentially always, there was a long list of causes that the board could remove the chief at any time for. That gives me real concern about how that would work. The other major concern that I have is that the charter changes that stands now does not really doesn't offer predictability and clarity for our officers about how they will be disciplined. And that, I think, to me, that's a big problem right now. I think the big issue in policing right now is, as we're going to be talking about Monday with the council, is that we are losing officers quickly. We are at risk of not being able to provide the services that that the public expects the Burlington Police to perform, and we don't have new systems in place yet to replace officers in responding to some of those and providing some of those services. So I think, as it currently stands, the charter change worsens that problem, and that is the biggest reason why at this point I can't support it. I have some other concerns as well. My hope, though, I will say, is there's still some time here. I'm continuing to look and search for whether there is a way that we could get to consensus. I continue to want to support a charter change on police discipline. I think the charter is problematic in this area. It does need to change. And I'm continuing to do what I can to try to find some kind of consensus so that this could go forward and there could be a ballot item in front of voters that would move this community forward and generate consensus instead of being divisive and polarizing.
Do you think the public hearings that are coming up in January, will that be an opportunity to discuss ways to reach consensus?
That part of the process does allow for some amendment. And so, yes, I do think there's some possibility there. That is one of the ways that we could get there. Yes.
Okay. Thank you so much.
Okay. Thank you, Courtney.
Next question is from Grace from VT Digger, and reminder for members of the media, you can let me know if you have a question by sending me an email. And Grace, you should be able to enable your microphone now.
Great. Can you all hear me?
Yes. Hi, Grace.
My first question is for Superintendent Flanagan. I'm curious if you could break down the identity of those cases. How many were students, teachers, staff? And then I'm also curious if you can offer any explanation as to why you think these Burlington schools have experienced more cases now when it had experienced no cases prior to December 10th.
Sure. Yeah, I can't actually give a breakdown exactly of cases because of confidentiality. We've been asked to not give specific details about individual cases or groups of cases. We have had cases among students and staff. The reason that I believe, and I don't have a great answer to why there are changes now, why we're seeing cases over the last few days, other than that there has been an uptick of cases in the community. And so I believe we are reflecting the uptick in cases in the community. And we're seeing them because we have really strict protocols for understanding when people are symptomatic and making sure that we are available to families when they have questions. And so I think people feel, number one, we're catching those cases. Number two, people are reaching out if they have concerns, and that is why we're seeing the cases we're seeing, and we're able to identify those as well.
Gotcha. Thank you. And I do have one off-topic question for Mayor Weinberger. I just wanted to ask about this hearing that's scheduled for Monday about the quash for your deposition in the Melly versus the Burlington Police Department case. I was curious if you could just articulate why you feel like you shouldn't be deposed in this case.
Sure, Grace. I mean, in general, this is, the city is frequently involved in lawsuits. It is part of being a municipality that it's not an uncommon event, and it is also not uncommon for the party that is suing the city to attempt to depose the mayor for a variety of reasons. And routinely, we have, and I think many other public executives often oppose those depositions for a variety of reasons. It is often really not clear, as it isn't clear here, what additional information I could offer that has anything to do with this case, which is about the Officer Sergeant Bellevance's interaction with Jeremy Melly. I certainly, it's not all clear what the questions that have been asked of Chief Del Pozo and regarding his social media account, which is one of the reasons they're trying to draw me in, has to do with that. So that's what the judge will have to determine, whether there is some relevance, and I expect the judge will be making that determination shortly.
Gotcha. Thank you. That's all I have.
Okay.
And it looks like that is all the questions we have for members of the media today.
Okay, very good. Thank you, Grace, Courtney. Thank you, everyone else who turned in. Superintendent Flanagan, really appreciative that you were able to make your schedule work to join us and help get this information out. I'm sure the parents of Burlington students will appreciate having heard directly from you in this way. And Brian, thank you for all the work you're doing. Again, have a great weekend, everyone. Stay safe. We may or may not have another briefing before the Christmas holiday next week. Regardless, as people are making their plans for that holiday, just say once again, please be safe. Please be aware of the increased prevalence of the virus that is happening right now. Please understand that the way in which one of the main ways we believe that the virus has been spreading in recent weeks has been through social gatherings between households. So be careful. Please do everything you can to slow down this increase in caseload that we've been seeing, and stay safe. We'll talk to you all again soon. Take care.
Thank you.